On behalf of the College of Science and Engineering's Alumni Board, welcome to this webinar. We are very pleased to feature one of the college's most prominent rising stars, Dr. Stevie Chancellor. Dr. Chancellor's research is at the nexus of several topics that are dominating the news: AI, social media, and mental health. My name is Amy Anderson, and I'm a member of the Alumni Board, where I serve on the Alumni Engagement Committee. We bring you events like this. I graduated from the U in 1987 with a degree in computer science. As now, students were expected to have a concentration within the computer science area. And in 1987, I chose artificial intelligence. My current colleagues, many of whom were born well after 1987, think it's hilarious that AI was even a concentration in the 80s. And although my AI focus was around natural language processing, we loved a little programming language called Lisp, we spent a lot of time talking about what could be if only we had the compute resources to do it, the processors, the memory, the storage. Well, those resources are available today, and the field of AI is accelerating at a breathtaking pace. And in the middle of that breathtaking pace is our own Dr. Stevie Chancellor. She is an associate professor in the Department of Computer Science and Engineering at the University of Minnesota. Her award-winning research focuses on interdisciplinary work between AI, human-computer interaction, and mental health. She and her lab build better and more ethical AI for high-risk mental health behaviors in online communities. Her work and opinions have been covered by international outlets such as the United Nations International Telecommunication Union, the New York Times, the Washington Post, Ars Technica, The Verge, and The Atlantic, as well as local outlets such as Minnesota Public Radio, the Star Tribune, KARE 11, and CBS News Minnesota. We're very pleased to have her here. And with that, please take it away, Dr. Chancellor.
Thanks so much for the very warm introduction, Amy. I'm going to go ahead and share my screen let's see. Can someone give me a thumbs up or an emoji reaction that you can in fact see the screen? Excellent. And I am not sharing an embarrassing Spotify playlist. Perfect. Okay. Thank you all so much for the wonderful introduction. I'm Stevie Chancellor. I'm an assistant professor in computer science. And today I'm going to talk to you about my research in AI, human-computer interaction, and what we can do to help make headway in challenging issues around mental health. I just need to note ahead of time, this talk does talk about mental health, and you or a loved one may actually experience and have dealt with the repercussions that severe mental illness can cause in your family or with your colleagues or loved ones. There are a couple of examples in this talk that may come off as pointed or a little bit more intense. What I've done to indicate this is in the bottom left-hand screen, there is a little caution yellow arrow that says, hey, the next slide is going to have an image of something that I think may be a little sensitive. I'll also verbally remind you about this before I transition on the slide. If you feel like you need to look away, I totally understand. That is important for you to take care of your own well-being. And I promise you won't actually miss that much of what I'm trying to talk about when we get to that information. So let's go ahead and talk about mental health. And as I mentioned, mental health is a really, really pressing challenge. If you or a loved one have ever experienced any sort of mental illness, you know the kinds of tolls that can have on your physical, mental, and sort of financial and emotional well-being, and the impacts that that can have on larger groups and communities. If you haven't been paying attention to the news much about mental health, you may know, or if you've been paying attention to the news, you probably know that mental health has really gotten intense in the United States. About 1 in 5 people in the US live with a mental illness. And there's a major gap in the care and availability that we have for people in even places like Minnesota, which is one of the best resource states for mental health care in the country. Something like 60% of psychologists have no openings for new patients. The median wait time for psychiatry appointments is somewhere between 60 and 75 days. Just to see a talk therapist can take up to 45 to 50 days. And if you've experienced depression or anxiety, that feels like an eternity. And there's huge gaps in our care system right now in getting care to men, teens, people in rural areas where doctors are not nearly so plentiful as they are in the Twin Cities where I live. And so all of these pressing social challenges have like made mental health in some ways a national crisis. Even the Biden administration has noted that the levels of mental health are reaching a crisis level in the United States. So my work over the last decade has tried to figure out what are we going to do in the moments where we can't have these psychiatrists or these therapists as resources? And how are we going to leverage data to be able to bring care to people sort of in the gaps between what a wonderful, experience that a therapist might provide and what you might receive if you had no care at all? So I'm going to show you a quick example and little video of one of the most exciting advances in the field, ChatGPT. Now, this is an example of something I typed in last night where I was acting, I wasn't acting. I was trying to act like I was having depression symptoms. Two common depression symptoms are having trouble sleeping or insomnia, and normal activities and hobbies make you not as happy as they used to do. It's called anhedonia. If you go into ChatGPT and ask it to talk to you about its symptoms, it will give you this long list of content about ways to improve your sleep and well-being. Now, I deliberately picked something here that was pretty like open-ended, right? I'm having trouble sleeping. But in the case of mental health, you probably know that the symptoms can get more substantial and worse. ChatGPT and other AI systems are now at the cusp of being able to provide people these kinds of insights. And now systems like ChatGPT and other AI technology that's available to the public make this kind of resources easily accessible. Now, I want to be clear, it's not just ChatGPT that's made these kind of resources available to people. Since 2018, there we go. Since 2018, Facebook has actually been predicting behind the scenes whether or not people may be considering harming themselves or taking their own life. They introduced an AI system based on some of the work that my previous PhD advisors group had done, where they were using Facebook data and other information like your text and chat history to infer if someone may be suicidal. At the time, Facebook claimed that about 10 people or so a day were actually detected by the system that were not already reported to the platform. And Facebook's claim in many of the press reports about a year after the system was deployed, was they were literally saving about 3,600 people's lives because they could deploy interventions. Similar to ChatGPT, companion AI chatbots have now started surfacing as the first line of defense for many people in taking care of their mental health. It's not just Facebook that's providing these kinds of services behind the scenes. These people like BetterHealth, Coco AI, and ChatGPT in many cases are actually trying to provide people care when there are gaps in their availability to get to doctors. Which leaves me with the question of, can AI support people when they're struggling? Can we save lives? Now, I'm a little bit of a cautious optimist when it comes to technology, and I think that there's an enormous opportunity here to make headway in treating mental illness with AI. I want to be clear, I'm not presumptuous enough to call myself a medical doctor. I can't prescribe prescriptions. I can't do long-term therapy. But in cases where there are gaps between this care that you get through a doctor's office and the inability to literally see doctors, I think that there's a lot of opportunities to make this kind of service better and more accessible, to start to solve many of the gaps that are caused in our mental health care system. However, I did say that I'm cautiously optimistic, and my caution is very well warranted. You may have seen a lot of public news articles about how AI systems are actually damaging people's mental health. One of the biggest ones in the last couple of years was the Facebook whistleblower who brought documents to the Washington Post and the Facebook files, saying that Instagram and Facebook knew from private research they had done that the algorithms they were using to show teen girls content was actually hurting their body image and causing girls to actually develop eating disorders. And they knew this and they did nothing to stop it. Likewise, systems like ChatGPT can be made to act in ways that are damaging to people's mental health. And instead of giving the positive recommendations that I just showed you with the video, are actually giving really harmful recommendations about ways to maintain and make eating disorders worse. In some of the worst cases, ChatGPT has been shown that it will give people advice on how to end their own life. Now, I want to be clear, AI systems really should not be doing that. It's not just social media systems that are doing this. This is an image of a screenshot I took from Amazon about 6 months ago. where Amazon was making one click to buy recommendations of these two substances that you could purchase together. What Amazon engineers probably didn't intend was for there to be a recommendation that these two substances, when you take them together, are unfortunately a suicide cocktail. This was reported on amply by the New York Times, and Amazon either could not figure out how to handle this or did nothing to stop these kinds of recommendations from being made. Clearly, Amazon doesn't want to make these kind of recommendations, but AI is causing these kinds of things to appear in our common experiences and vernacular. And if you don't believe me that this is a reason to be concerned, there's a lot of ethical issues that come up when people start using chatbots and other systems to share data. BetterHelp was recently found in violation of sharing private data about people's mental health experiences, and now owe a substantial amount of money back to the FTC because they were breaking their data sharing principles by giving data out to private brokers and ad agencies. Likewise, suicide hotlines that operate digitally have been found in sharing data with a for-profit spinoff. This for-profit spinoff actually was being developed to keep the hotline afloat. But they didn't really mention when they were starting this effort was that the for-profit spinoff was going to be to build customer service AI so that other businesses could leverage sensitive crisis conversations, build AI agents to make effective customer service AI, and then pull that into all kinds of other business contexts. I can see and personally understand why so many of these issues cause people to get nervous and worried. And so this leads me to sort of my cautiously optimistic question as a computer scientist. Can we actually build AI systems that predict mental health from these data sources like social media or from their buying history on Amazon, from what they share to an AI chatbot, that are both accurate, aka work really well at identifying mental illness, but are also ethical and socially acceptable? Now, most of my research focuses on high-risk health behaviors. These are actions and behaviors that if you told a psychiatrist that you were going to engage in, they would almost certainly intervene in those cases. These behaviors are dangerous to the well-being of people who engage with them, and unfortunately, when shared, have contagion-like effects on others because you can learn how to hurt yourself from that sharing. However, these questions about ethics, accuracy of AI, as well as what to do in situations where you know that somebody may be struggling, are bigger than just crisis interventions. They apply when you notice a friend is consistently down and talking about how they're just like really dissatisfied in their life over a couple of months. Or when a friend shares with you that they're not able to actually stabilize the running thoughts in their brain, right? Those classic symptoms of depression and anxiety. And so to me, these are the kinds of questions that I want to answer when building technology to solve problems that are as pressing as this, because I want to do right by the people who built that. Now, the work that I do typically focuses on social media data. Now, the reason I like social media data, people go online and share a lot of information about themselves. Now, we'll talk about the privacy aspects of this in a few minutes, but when people can share unobtrusively and honestly, that means that we have the ability to understand their well-being and how their cognitions are coming out in discussing this either with friends or family, or in communities that are specifically designed to help people navigate challenging mental health issues like depression or suicide. Now, you might not be surprised. The approach that I take when I do this is called human-centered artificial intelligence. As Amy's intro mentioned, I do research at the intersection of building AI systems that can actually infer this kind of information from social media data, but I do so in a way that tries to incorporate human insights into this problem. There's no way that we're going to make headway in challenging social issues like mental health without considering how our technology is built. Does it meet the needs of people and communities that we're saying it will help? And is it something that as a society, we are enthusiastically excited about adopting to help us make headway in these really challenging issues like mental health? Now, I want to be clear, human-centered artificial intelligence is more than just doing one user study. It's kind of changing the way that we think about doing AI, where we find a data set, put it in a model, maybe make the model more performant or improve the architecture, and then spit out some predictions at the end. The whole pipeline of how I think about my problems changes when I take a human-centered approach rather than, say, a data-centered or a prediction-centered approach. I want you to make no mistake, I am a person who's really interested in the technical side of these problems. And at the end of the day, I'm a computer scientist who does spend a lot of time tinkering around with data and models. But what I'm hoping that you get from this talk today is that there are visions of AI that we can imagine in this in the research space, but also in development and deployment, that can start to think about human values too, and implement them directly as technical decisions that we make to the models, that can better reflect our care for other people who are struggling, our concerns about privacy, and sharing data and information about really challenging health issues that we really should probably take actions to try and resolve. Towards this point, I've got 3 parts of this talk that I want to talk to you about. The first is about the promise. What can we do with the AI systems that I've sort of alluded to in actually inferring mental health? This will be a little bit of a technical deep dive. So if you're an engineering person, get ready. This will be kind of fun. But if you're not really that familiar with engineering, totally understand. And the takeaways from the talk will just demonstrate to you that the state-of-the-art research that me and others have been doing in this space can actually make decent predictions about mental health. Then I'm going to transition into talking about some of the perils. Now, I use perils sort of provocatively here, but I think that this is better stated as challenges or really sticky paradoxes that we deal with when we start to integrate human insights and decision-making into AI that relates to people's mental health. I'll talk to you about my research and how social platform AI systems like the one I alluded to on Instagram affect people and what we're doing to improve it. Lastly, I'll wrap up by talking about visions of the future, potential issues with ethics, and some outcomes. This should have plenty of time for Q&A. I love to talk about challenging issues where technology and society intersect, and I'm really excited to hear what kind of questions you have at the end of this talk. But let's get into some of the technical details, the thing that I do every single day. What can we do to actually be able to use social media data to predict people's mental health? If you have any experience in building technical systems, predicting complicated social behaviors using people's data is pretty hard. Let's also add in the complexity of understanding a nuanced, personalized experience like mental health. And suddenly that pushes computer scientists to have to develop new techniques to deal with the challenges in this area. So some of the challenges that I come up with on a day-to-day basis are things like, how do you get good labels on data when you are working in the millions or hundreds of millions of data pieces or data sets? We can't get humans to label all of that data. How do we know what we're looking at is actually related to depression or suicide or anxiety? What happens too when mental health changes over time? Most people, if you've experienced mental health, like I've had issues with my mental health, you know that this your experiences and episodes with mental health come in waves and bursts. Your health is not the same all the time. And so permanently classifying a person as depressed for forever or not is actually not a good way to model people's well-being, nor does it respond to when their well-being is changed, and the stakes for intervention, therefore, might also change. Finally, there's this really interesting challenge that as humans, we're great at handling. We know how to read text and images together as a caption for a video, or on Instagram, when you're scrolling, you know how to read all of the content together. Computers are not so good at that, and we have to come up with ways to handle what we call multimodal data sets that let us integrate insights from videos, images, and text into one coherent representation. So I'm going to talk to you about this challenge with getting good labels. Now, if you imagine I've got a data set of 1 million posts from social media, even if I've searched this data using hashtags that are clearly related to mental health, like hashtag depressed, it's really difficult to know that a person who's posted hashtag depressed is actually depressed in the sense that I care about, saying that they might have major depressive disorder. For example, hashtag depressed could mean that you have a symptom. Depression is a symptom of other mental health disorders, including bipolar disorder. Depression can also be a transient emotion that you express, and use the term colloquially to reference the kind of experience or emotions you're feeling, right? You might say that I'm depressed that like the Vikings lost, or I'm depressed that Manchester United lost. Now, when we hear that, we intuitively know that doesn't mean you actually have major depressive disorder, right? It just means that you're really sad right now. but the computer can't tell that difference unless you teach it how to know the difference. People can also use depression and hashtag depressed to reference emotional states that they have, but they may actually use it to refer to a category of depressive disorders, of which major depressive disorders are one. So I've got my million posts. I've got maybe 400,000 users in this data set. How do I figure out what hashtag depressed maps to? What happens when people's depression changes over time? Now, you might say it would be great if you could have doctors to label this, and I totally agree. I work with clinicians a lot. The challenge is that labeling 100,000 posts or a million posts or 400,000 users' unique experiences can't scale to what AI systems are now capable of handling today. And if our data sets are too small, we risk pigeonholing the AI systems into one experience of depression, anxiety, or whatever condition that we're studying. So fundamentally, labeling big data sets is actually really, really hard. And so one of the fundamental questions that I have in my research is, well, how am I going to get good labels on data sets accurately, but then build AI systems that can handle these labels that, while imperfect, provide us some insights into what's going on? So today I'm going to talk to you about a study that I ran where I gathered about 26 million Instagram posts from people who had talked about engaging at some point in a dangerous mental health behavior. When I say dangerous mental health behaviors, please know that I'm talking about the actions that people are taking that I said might actually encourage a clinician to intervene. These are specifically self-injury, suicidality, and dangerous disordered eating behaviors. Now, we wanted to focus on people who are engaging in dangerous behavior specifically, in part because their discussions of this content are very clear. Very few people talk about hurting themselves or self-injuring unless they actually mean that they're doing that. And so we sort of sidestep some of the challenges that I mentioned to you about the hashtag depression thing by targeting people to look for their data on these public APIs that talk about dangerous behaviors. But even then, a person may have mentioned that at some point they engaged in self-injury. How do we understand how people's illnesses change over time? I'm going to show you 3 examples of posts that a user had posted at some point on their timeline. And this is where I just need to do a quick content warning. There is one content on this next slide that's a little graphic. These are 3 example posts taken from my Instagram data set. If you go from left to right, I blurred out this image, but it's a photo of somebody's tattoo. You see this quote where somebody says, when you live in the dark for so long, you begin to love it. And you think the facts turn to shadows, and just as well. The shadows accept, it heals, it allows, but it also devours. And then the last one is an example of this person who had disclosed that they had engaged in dangerous eating disorder behaviors. These images show common body parts that people with severe eating disorders idolize, that show their thinness or their commitment to their disorder, which is primarily their collarbones, hip bones, and their thigh gaps. Now, intuitively, I think we can all understand that on a scale of left to right, the image of somebody's tattoo is not nearly as severe as somebody talking about idealizing their collarbones to show how good they are at sort of holding up or supporting their eating disorders. The challenge, though, is that computers don't understand this information that well. They can maybe understand what is being shown in images, but we need other contextual information to be able to have a computer know that the image of a tattoo is not nearly as urgent for an intervention or in terms of the severity of a mental disorder than the images on the right. That's when we turn to things like the captions that come along with these images. Now, I want to take you back to 2015 when I was doing this study. Computer vision, which is the field of machine learning that analyzes images, was not nearly as good as it is today. We had models that worked very, very well on objective data sets, like understanding cats versus dogs, but we didn't have good models that integrated the multimodality of data together to be able to have text and image be processed uniformly. And to be frank, there aren't a lot of publicly available data sets that label complicated stuff like the ones that I work on. So we have to leverage other contextual information to get good data labels. Now, I showed you that these are some of the examples of the captions that I showed, or that I'm showing you from these posts. And you can see that the captions also map to the same kinds of concepts that I was talking to you about. Somebody is talking about this dragonfly sketch or illustration that they were hoping to get as a tattoo, whereas the image on the right was way more severe. And the hashtags kind of confirm our suspicions that this person is dealing at this time, probably with a severe eating disorder and possibly talking about injuring themselves. Now, I'm a computer scientist by training, as I've said. I can start to understand the nuances of this because I've been in this field for 10 years, but I'm not a doctor, which means that I need to bring in collaborators with me. So myself and my PhD advisor, Mumunda Chowdhury, who is on the bottom right, collaborated with two clinical psychologists, Stephanie and Erica, left, and Stephanie is left, Erica's right, on building an AI system that could leverage this multimodal data set and these contextual clues about people's severity of their eating disorders. Now, the reason that we really wanted to work with Stephanie and Erica at this time is because they worked inpatient with people who had eating disorders, and they were able to talk to us about the nuanced signs and symptoms that someone's disorder was getting better or possibly getting worse. And this is really important when we start to blend computer science with other fields. Working with people like domain experts, like Stephanie and Erica, means that I can have more confidence that the algorithms I develop are actually correct. But importantly, I'm humble enough to recognize I can't label all of this stuff by myself. I don't have the domain expertise, even though I've been working in this area for so long. And they provide that important insight to being able to break ties, but also to identify strategies that I wouldn't see as a computer scientist on how to scale. And in fact, they showed us this really interesting idea that we leveraged in a computer science AI technique called topic modeling. They pointed out that the hashtags that people were talking about kind of clustered into 3 topics. I've highlighted these in teal, yellow, and pink. And they noted to us like, hey, what if you just like looked at the topics that people were talking about? Conveniently, in natural language processing and AI, there are models where you can actually ask computers to cluster the text that you have into topics. It's called topic modeling. You can give it long text like Wikipedia articles, or you can give it short text with some modifications like ours, short text being something like less than 50 words, and give them the content and ask it to infer, okay, what do you think are the topics that actually appear commonly together? And in a given post, how many topics appear? So that's what we did. We worked with Stephanie and Erica to develop a topic modeling system that actually clustered the kinds of hashtags that came along with posts to take advantage of the contextual information that they provided. Now, the topics here are really valuable because topics can show severity, but topics also can show change over time. For example, the blue topic of suicide and cut, if the blue topic is more prevalent on a post compared to, say, the yellow topic, which is people talking about their eating disorders, you might infer that the topic or the post with more blue text is going to be more severe. That's the intuition that we brought Erica and Stephanie in to develop as well. They pointed out that people talk about a lot of content on these things, but they actually had a concept from clinical psych that we could adapt for our purposes, which is using the notion of mental illness severity. Now, this is a commonly grounded clinical topic where you kind of put people's illnesses into zones, roughly cut of low, medium, or high. Now, if you've ever been diagnosed or know somebody with depression, you'll know that the screening criteria we use in these areas map to people's different mental health status. It maps to things like a low depression or like mildly depressed, moderately or severely depressed. So we use the intuition that they had from seeing people in clinic to marking posts that were related to levels of mental illness severity. So we asked them to label about 200 posts with whether or not they thought that the MIS level was 1, 2, or 3. We also asked them to go back. I'll go back to the slide for a sec. We also asked them to label when they thought the topics themselves may be indicating more severe content. And we can leverage these 2 labels together and augment LDA or topic models, which if you're curious, I used an LDA topic model here. You can augment the LDA with the ratings that they've given to come up with a more representative understanding of the topics and their severity taken together across an entire post, which means that we're able to come up with the understanding of people's overall communication on these posts rather than just sort of using 1 or 2 hashtags as signal for what they are talking about. It's really cool that we can do this as well, because topic models, when you have a data set of say 5 or 6 million, run a much faster than any human rater could run across these data sets. Now, because I really care about getting the answers right on these things, I'm a little bit ornery and focus a lot on getting answers right. We worked really hard to improve the quality of these labels. Working with Stephanie and Erica's ratings of those 200 posts that I mentioned together, our system was accurate and aligned with their labels about 90% of the time. Most of the time, the error was actually between distinguishing between a 2 or a medium level or a 3 or a high level. What's also really cool is that because we can leverage the system to label across the whole data set very rapidly, we can also use it to understand how people's posts about MIS change over time. That's one of those challenges that I mentioned earlier that may make predicting mental health and social media data that much more challenging. So this is a summary graph of our results. If you look, let me restart. This is a graph that shows how people's MIS changes over time over the course of their posting history. On the bottom of the x-axis is the number of months that they've been on the platform, which starts at 0, so someone's first month on the platform, all the way up to 55 months. So we had about 6 years of data in our big data set of about 26 million posts. Now, what we were able to do is run the topic modeling system across the whole data set and get scores for people as they changed over time. On the left-hand side is the fraction of user content that is medium or high, AKA they have posted things that are in the vein of 2 to 3. On the right-hand side is the fraction of users who are low, which means that the content that they're posting is in the MIS level 1. They're talking about content related to, say, tattoos or pets or travel, definitely not related to mental health necessarily. What you'll notice though, and the one thing I'll point out is that these graph axes are opposite of each other. The fraction of users that are medium to high starts at 0 and goes up to 15%. The fraction of users that are low starts at the bottom at 70% and goes up to 100. So they're inverses. And so you can intuit this graph in 2 ways. One, most content on the site, even of people who are talking about having and experiencing dangerous mental illness behaviors, not actually that severe. Most content, we'd say about 85% of the content shared in our data set, MIS level 1, nothing related to people's severe mental illness, which surprises many people when they realize that they're using their normal accounts to talk about very severe illness experiences, but also more mundane things that the rest of us experience, like frustrations with teams losing in sporting events, the tattoos that they got, or their pets. But what we do notice, however, is this increasing trend of the blue and red lines, the medium and high scales. We notice that over time, as people are spending time on the platform and engaging with the content, that their MIS ratings actually go up and they start posting more and more frequently. Now, our study unfortunately wasn't able to map why this was happening here because we didn't have a causal explanation of, well, are people coming to social media to find others? Are they feeling more vulnerable and they need to share? Do they feel more comfortable talking about their experiences? Or is something on Instagram actually causing them to want to share more content? It's really hard in these big data sets like the ones that I work in to develop causal explanations. Towards this end, we worked on other platforms like Tumblr, where we've been closer to the data when I was working there as an intern, to understand when and why and how people recover. And so we've used data from Tumblr. This data set was about, I don't know, 8-10 million posts to be able to understand the reasons behind why people recover from anorexia and start talking about other kinds of content. And towards this point of the causal question that couldn't be answered here to what could actually be answered here, we actually learned that there's a shift that happens about 48 months after joining, or about 4 years. 4 years after somebody starts posting about engaging in content related to anorexia. Now, what's interesting here too, is we're able to use estimates of the behaviors that people engage in before they engage in recovery content, AKA post about their recovery, to infer what is causing people to recover or not. And what we learn is that sometimes when people engage with and share content that is from a certain kind of anorexia content, that is supportive of them recovering and recognizing their disorder and their distress, they're actually more likely to recover than people who share and engage in content that actively encourages a disorder. Now, intuitively, this makes sense. People who are well supported emotionally are more likely to have good outcomes with their mental health care. But it's valuable to show this kind of causal relationship as it appears in the social media data sets, because that lets us make better inferences about how people engage with social media to take care of their health, but also what we can do as a society to prevent people from being harmed by content on social media like this. I also mentioned the challenges of multimodality considerations. In the Instagram project, we had to take a pretty blunt or naive approach with the images and just use what we could see in the labeling process to incorporate that data into our pipeline. But we've since then developed multimodal considerations where we actually analyze the content of the images as well as the tags to be able to predict if content can be removed from places like Tumblr. But importantly, what kind of content is in the gray zone of where we may want to do something about it that may not necessarily be content removal because it encourages something pretty dangerous. All right, that's all that I have for the technical side of this talk. So if you've zoned out for a few minutes because you got a little lost in the sauce, take a breath, we're back here. But what I want to show and emphasize with this is that not only in my group at the University of Minnesota, but across a group of really dedicated computer scientists, we're making really big headway in improving the state of the art for AI to make headway on the prediction challenges that I started off this section talking to you about. I'll tell you that honestly, prediction for some of these tasks is somewhere between 80 and 90% accurate. Now, obviously, if you work in software, that's a pretty low accuracy rate to be able to develop in a production system right now. But recognize that my foresight into production level readiness is about 5 to 10 years in the future. 5 to 10 years ago, when I was doing this work, we were getting 80, 85%. And now the advent of tools like ChatGPT, as well as others new image recognition technology has improved these beyond even what I thought was possible when I started working in this space. I will pause here to mention one thing that's actually been really challenging in this research. If you've been watching the news in the last couple of months, you may have heard that API systems that are provided by social media companies like Twitter, Reddit, and TikTok are essential to the infrastructure of the work that I do in research. Unfortunately, many of these companies have made these APIs that I've used for my work be highly, highly expensive. I'm talking, I can get that million posts per month from Twitter for $5,000 a month. For reference, like that would be about that'd be $60,000 a year for me to be able to get a data set that's about half the size of the one that I used for my study about mental illness severity in Instagram. And these kind of barriers are surprisingly cropping up where now I can't access the APIs to get this kind of data. Now, I don't mention this here to like scare y'all or think that this isn't going to be successful research. We're figuring out ways to work around this. And many companies are listening to researchers when we point out that their new policies about charging for API access for researchers really inhibits the work that I do. But it's important to recognize too that folks like me need access to these kinds of resources. And while this isn't specifically related to AIs itself, it's an important infrastructure that supports the work that researchers like me at the U do. And I like to bring this up because a lot of people hear about the Reddit strikes or Twitter changing its API and can't actually see the material consequences of what that has on the research and impacts that we have for the research at the U. All right, we're going to shift now to some of those perils or what I call paradoxes now, the human side of predicting mental health and social media data. I'm going to talk to you today about TikTok, the For You page, and mental health, which is a new area of research for me that I'm personally really excited about. And what I've shown you so far is that underlying AI infrastructure that we've built and my group has built can actually identify people who have mental illnesses and well-being challenges. I'm not saying that this problem is like well solved, but we're certainly making headway in solving these kinds of challenges. However, when you start to think about the AI prediction system that I just presented to you, there's actually a little nuance in what it can do. What I've shown you so far is we can use it to identify or diagnose, if you would want to use that term here, people in social media data that are talking about experiencing these behaviors. Identification is slightly different than intervening or making influences on people's behaviors. And so what I want to talk to you about now is how AI systems can intervene or change people's behaviors, and what we can do to alter or to basically confront those systems that are actually damaging to your well-being. And I'm going to bring you back to this example that I talked about earlier of real world impacts of AI systems influencing or changing people's behaviors. The Facebook whistleblower report showed pretty unanimously that Instagram's recommender systems, or its algorithmic curation powered secretly by an AI, was actually hurting people's body image. And so we can attribute a lot of AI systems to actually not having sort of the pro-social benefits that I really care about my research having. So normally when I do this talk in person, I ask about how many people in the audience have raised their hand, or have, I ask people to raise their hand and ask how many people use TikTok. If I'm asking undergrads, it's about a third to half. So if you use TikTok, I'd actually like for you to jump in chat and say like, hey, I've actually used TikTok, or I possibly have a sibling or a friend who's used TikTok and I know how to use it. If you haven't used TikTok, don't worry. I'm going to show you 2 examples of content taken from the mental health communities that post to them. TikTok is a short form video platform where you can see videos of a lot of content. So let me show you 2 examples here of content. I'll just warn you, these videos aren't probably going to come through in Zoom captions, and the audio is a little quiet for me right now. And so I recommend you turn your volume up for the next maybe 30 seconds.
Someone's having an anxiety attack. Here are 4 things you should be doing to help them through the attack. Number 1, stay with them and provide reassurance.
That's the first video. Advice from a doctor who works with people who have anxiety. This is video number 2 from a creator like you and I who talks a lot about ADHD.
Good question, but you know where any paper clips are? Yeah, if you go to the cabinet that's next to my basket of clean laundry and then go to the 3rd drawer, in the back, there's a plastic container and there's 1 blue paper clip mixed in with loosely stored rubber bands.
All right, these are 2 examples of videos that we actually took from some of our participants that talk about mental health. And you'll notice the first one actually contains clinically grounded, pretty solid advice. What I'll tell you is the advice in the video about managing anxiety attack, pretty good. Second one is making fun of one of the common symptoms about ADHD, which is hyperfixation on details that may not necessarily be important, which is why they know where that 1 blue paper clip is downstairs. Now, TikTok is a hugely popular social media platform for teens and young adults. About 1 billion monthly users are active on the platform across the world, which is about 1 in 7 to 1 in 8 people. TikTok has also a huge community of people who talk about mental health, their well-being, and also their experiences in trying to help themselves feel better. Now, what's interesting here is that the TikTok community, TikTok did not start as a mental health app where people could go in and share their insights. Teens and young adults just started using it to talk about their well-being challenges, from depression and anxiety all the way to more severe or dangerous kinds of behaviors like the one that I focus on. The other thing to know about TikTok is that its interface, which you can see in these 2 screens, is a single screen of scrolling videos. You don't really have choice about scrolling past the videos because there is 1 feed. It is called the For You feed, or what I will occasionally call the FYF. It means it's really hard for you to get content that is not within your FYF because this is the primary mode of interaction on the app. If you've been paying attention to the news, TikTok's been implicated with anecdotes of how diagnosis can harm people's well-being, but has also been found that it supports people's ability to get more clear diagnosis and also raise awareness for stigmatized mental health conditions like ADHD, PTSD, and bipolar disorder in particular. So when I start to think about TikTok and the FYF and how it's giving people these kinds of videos that I just showed you, I start to think about questions about how these AI systems influence or affect people's behavior. Who controls the influence of the system, right? Is it the users who are seeking out and liking and engaging with this information? Or is it the AI system that's trying to infer based on your other habits, what kind of content you may like, which may be related to mental health? Maybe it's both. If I wanted to intervene in an algorithm that I thought was being harmful, how or should I do that? You know, I think about questions about, well, if we do think that Instagram or TikTok may actually be hurting people, What could I do as a computer scientist to make these kinds of interventions? And then fundamentally, if I can even make an intervention in this space using the technological resources at my disposal, how would I personalize this such that it's an actually effective intervention, but not be creepy? You'll notice a lot of hows and whys and shoulds in this, and this is not for dramatic effect. I'm a technologist, and I realize that computer science alone cannot answer these tough questions. I can't sit and puzzle over a data or ask my clinical collaborators, like the doctors I worked with in the other study, enough questions to know what the right things to do are in these situations. These are challenging questions that have complex answers. Towards that point, I turn to methods that are available to us in other disciplines that are not just exclusively computer scientists. And this gets back to my training and interest in human-centered artificial intelligence. So I turned to methods outside of CS, like those for interviews, talking to people, doing workshops, doing in-depth observations of how people use social systems, so I can learn about their experiences, needs, and other information that might be important in knowing how and when to make a good intervention. I also draw on a larger collection of evidence to actually make empirical studies even more valid. And so for me, working with humans directly in long-term engagements, lots of studies, lots of time invested here, means that I have a higher likelihood of success to make a model that works and to meet people's needs. Now, I've talked to you about this in the abstract. Let me actually be specific about some of the work that we've done in the last 2 years. So far, we've interviewed over 40 people across 2 studies to understand how resources like the For You feed on TikTok affect their mental health, but also what people are trying to use these feeds to be able to gather. We want to know what kind of information people are looking for, how they evaluate mental health information, and what the role of these feeds is in helping or hurting their mental health. You may be surprised to find out that a computer scientist like me is sinking a lot of time into interviews, but I believe it's the only way that we can know what people actually want to be able to bake better systems and to have confidence that the work that I'm about to do when I build a new AI technology is actually going to solve their needs, not just the ones that I am presuming that they have. To that point, I'll share 2 quotes with you that people shared with us about their use of TikTok and the For You feed. This participant talked to us about how delightful and wonderful the For You feed was. They said, I see other people sharing their mental health experiences because I see other people sharing their victories and I see other people venting. Fundamentally, I see me here. They saw the For You feed as a way to give them high quality information, both about the mental health care that they might be looking for from a therapist or a psychiatrist, but also other people who were experiencing the same kind of distress that they had experienced too. And in that way, the For You feed was really supporting their information seeking and their ability to get the kind of support and care that helped them take care of their mental health even more, even better. But as I've alluded to, the For You feed has some challenges in the way that it presents information to people. This participant talked about noticing that the For You feed has a lot of negativity associated with it. I'm not entirely sure why, because my feed is different from other people's. It's others that I see are not like that. And they noticed that their feed in particular had gotten associated with a lot of negativity, which was very different than the first participant's experience of delight and gratitude of the kind of content that people were giving. Now, I want to be clear, participants often had a lot of experiences that shared between these 2 kind of options. And what we found kind of collectively, one of our participants called TikTok this dopamine slot machine, which I love that a participant came up with this, right? It's this idea that for every video that you swipe past, you don't know which side of this experience you're going to end up in. And because you don't know, it actually encourages you to engage with the algorithm even more. Now, when it comes to mental health content, this lack of control or knowing what the slot machine is going to give you can have really harmful consequences. Our participants talked about how the content would, in one hand, share videos about gardening or flower talk, which is people making really cool bouquets out of flowers from places like Trader Joe's. But they also talked about how in the next swipe, they may get some content that triggers them. And the algorithm doesn't realize when they want to stop seeing that content. And so their changing needs are not reflected by the people or by the algorithm, or their changing needs are not reflected by the content that is given to them when they stop interacting with it. AKA, the algorithm's not actually adapting to their mental health at the time that they need it. That means that our users talked often about having to either step away or stop, but perceiving the cost because they really liked a lot of facets of TikTok. They wanted low stakes support and digestible information, like our first participant had said, but they wanted to avoid the slot machine effect because it was sucking them in. So my student who's working on this project came up to me and was like, okay, these people, 40 people have told us basically the same thing. These algorithms are really engaging and getting people stuck and hooked. What should we do? Because our participants unilaterally dislike it. Thankfully, one of our participants in an interview gave us an idea of how we could model an intervention. They mentioned that they used to read choose your own adventure novels, where at the end of a page, you would get 3 sequences of actions you could take to act as the main character of the story. And at those points, you turn to certain parts of the book so that you would finish out the plot with the sequence of events that you had chosen to make your own adventure different every time you read it. Our participant talked about how delightful that experience was. And wouldn't it be great if TikTok actually let you choose your own adventure? They wanted automatic nudges to be able to say, hey, how are you feeling right now? Do you want to have some options to be able to remediate or to stop the influence of the algorithm? We think you may be in a bad spot. And so the solution that they had posed to us is when TikTok detects that I'm scrolling too much or quote, get what they told us is giving me bad content, give me a set of options, a choose your own adventure of sorts to be able to get this. Now, I want to be clear. I would have never thought of this idea myself because I'm sitting here focused on, well, how could you stop the content? How could you change it? How could you build the recommender system or the AI to not serve that content anymore? But this has led us to this wonderfully rich area for technical advancement that we would have never known if we didn't actually interview people in the first place. This is an interesting technical intervention in terms of using context-free versus contextual interventions. AKA, should I assume that after 20 minutes, everybody wants to stop using TikTok and wants one of these nudges? Or should I use more contextual information from what people have told us? Also, are there levels of interventions that are annoying versus helpful? And the idea of a choose your own adventure novel came to us with this notion of autonomy and agency, which participants told us about in this idea of balancing paternalism of interventions like the ones that I could develop to intervene in this space with care, and asking fundamental questions about whether or not we should intervene in problematic social media content at the general stage or in the general case. I'll tell you right now that we're working on workshops with participants to actually develop out what a choose your own adventure novel might look like for a platform like TikTok and for people who do have mental disorders and how they would want to be engaged with. We've started working on answering some of these technical questions, and I'm really excited for the next several months of work as my students use the insights that we've gotten from interviews to be able to understand people's well-being and help them make better decisions to support their health. All right, I talked to you about the human side. I talked to you about AI. I want to leave you with the vision of what I think the future could look like. You've heard me talk a lot about challenges that come with building systems like this. How do we deal with data? How do we deal with issues of sparsity and the modality of the data? And I think that there's a lot of interesting questions here because at the end of the day, and I told you before, this stuff is still research. Even in the best cases, 1 in 10 of my answers is wrong, not good enough to send a production system. There's a lot of consequences if we build these production systems of bad systems negatively impacting people's well-being. From my perspective, some of these are research level. I don't want to build bad models. I also don't want bad scientific or causal conclusions to be connected of how people use social media, how the AI system is affecting them, and for us to have the wrong sort of causal conclusions that come out of this work. But fundamentally, bad systems also lead to incorrect diagnoses, bad interventions, and possibly even harmful interventions that are coming up or that may be served as a result of the kinds of predictions that my systems make. But I want to pose a thought experiment. And the thought experiment here is taken from Jurassic Park and Jeff Goldblum, who sits and thinks about, you scientists were so preoccupied with whether or not you could. You didn't stop to think if you should. Thought experiment. What if we can? should we actually make these kinds of decisions? What are the consequences of good systems being built? And this is something I've mentioned several times already, and it's not surprising that I think about these kinds of questions day in and day out with my research. I get concerned about reproducing biases of data and who has access to social media. I think about bad actors and discrimination that could happen as a result of a prediction system that knows when you're depressed before you do and sends that information to your insurance company. I think about inappropriate application and dangerous advice, but also inefficient and insufficient information to know if we want as a society to adapt to these kinds of things. This makes us as computer scientists or engineers have to reconsider our role in building these kinds of systems. And these questions fundamentally will not be answered by technical folks or by policy folks by themselves either. While I do think it's important for technical people to have expertise and to work with people, we need coalitions of people that can think through the consequences of systems once they're built and developed for this, but also the ethical and social outcomes that come from building systems. Issues like privacy and getting consent to do this research. Questions about doctor-patient relationships when Dr. Google now turns into Dr. Stevie Chancellor's AI system, right? That gets really complicated when I start deploying this on a large scale. How do we handle the duty of doctors to intervene? If a doctor sees you struggling on the street, they're actually bound to intervene, but Facebook is not. Are there material differences to those kinds of interventions if we know that my AI technology works just as well at doctors as detecting suicide? I don't know. These questions are really, really hard. And this is where I come back to the vision of what I hope that you take away from this talk, but also from what I hope that the research, as well as the AI community, starts to adapt. The vision of this work is that it actually helps people think through and decide on these complex social issues while the technology is being developed, rather than waiting for it to get deployed and us to have to clean up the mess afterwards. I've shown you in this work that you can imbue values into the design. You can work with doctors to make better clinical inference. We can talk to people and understand their needs before we build an intervention system. In this way, we use human-computer or human-centered AI as a tool that can be in service of society, not just a tech-forward approach. And I believe that we should build these kinds of tools like this with these at the forefront of our concerns. And if we don't, we run the risk of bad prediction systems, a la Jeff Goldblum, or we run the risk of building things that work really well that we didn't consider how it would materially help or improve our well-being in society. With that, I'm going to wrap up because I am a smidge over time. I'm going to leave a couple of these provocations up, but if you have any questions, please feel free to jump into chat. Thanks so much.
Thank you so much, Dr. Chancellor. This has just been a wonderful presentation, very thought-provoking. We do want to be respectful of everyone's time, so if you have to jump, please feel free to do that. Dr. Chancellor, might you be available for a few more minutes to answer maybe one or two questions?
Yeah, I can hang out for a few minutes.
Okay. With that, actually, Joelle, do you want to pick it up from here?
Did you want to ask a question or two first, Amy?
Sure.
And
Yep.
then I'll just do the closing announcements at the end.
Okay.
So if people need
Yep.
to sign off. My part's the least important.
Yeah. So yeah, we had several really thought-provoking questions. I had one person asked a couple of questions that are somewhat related to each other about mental health and climate change. And I know there's a lot of work that's going on with AI and climate change. So I'm just wondering, the person is asking if you're aware of or involved with a couple of groups. One is called the Good Grief Network, and it is related to people experiencing grief related to climate change. And the other one more locally is about the Hennepin County Climate Action Plan and their work around that and whether or not you're involved with them locally.
Yeah, so I've recently got interested in the use of social media data as it helps us understand the impacts of climate change. There's two collaborators that I've started working with at the U, Catherine Grant over in geography, as well as Jude Mickle, who's in public health. We recently have kind of a perspective piece about how you could use social media data to better understand sort of the consequences to human infrastructure. I'll use that term real broadly, but what I care about is the consequences of climate change to impacting people's well-being. So the answer is yes, this is a new area for me that I think would be really exciting and instructive to get involved in. I just don't have any data or exciting insights that I can tell you all about yet.
Okay, wonderful. There was another question related to it was in the news recently that Facebook is going to pay $52 million to content moderators who are experiencing PTSD. And the question, and I had a similar question myself, is can AI replace those moderators who experience a lot of trauma from what they have to look at on a day-to-day basis?
Yeah, okay. So I wasn't able to talk about my research in content moderation today just because of the scope of the talk. I wanted to talk about the AI mental health stuff more. I have a lot of research about the role of moderators in both identifying content related to mental health, using AI as a proxy system for mental health content identification, but also in how moderators are treated and thought of by large platforms that do value and leverage their data. The short version is I do think moderation is a very dangerous and under-resourced profession. Moderators have to look at really, really damaging, awful content on a day-to-day basis. And for a long time, they were often hired in contractor roles in places outside of the United States where they were paid very poorly and didn't receive psychological care or management. Common techniques that we actually use in other fields that see a lot of traumatic content, like ER doctors and nurses, get a lot more care for psychiatric and trauma than do content moderators. Short version is, I do actually think that moderators need to be taken care of in their labor much more sensitively than they are done now. And I do support moderators having things like care for PTSD. In terms of AI replacing moderators, I think that that gets really challenging when you have complex, ambiguous, or gray content that may be on the edge of something that could hurt somebody else when they look at it, but may not explicitly call for, say, somebody to injure themselves. At some point, humans have to intervene and engage with that content. And there's been a lot of promising work in using AI to help perhaps blur or alter that content so it is less traumatizing, but people can still get the gist of what's going on. I support generally these kinds of efforts in using AI systems to make moderators' lives easier, while also respecting that it's really important for content moderation to be done in a way that's sensitive, because over moderating mental health content hurts people too. It's challenging. It's really hard to handle this kind of situation. I don't think like Facebook or Instagram or TikTok have been maliciously like, aha, we're gonna like not take care of their moderators. So much of this is just because the scale of these platforms has just blown up in the last 15 years. I don't think they were ready for these kinds of socially sticky issues.
Yeah. And then one final question. Where does binge drinking fit in with the idea of dangerous health behaviors, and particularly, binge drinking, and it's often glamorized? So how do you set up your, the AI to catch that kind of thing?
Yeah, that's a really good question. So I always like to draw two examples when coming up with issues that people may engage in that by themselves may be dangerous, but not related to a more severe expression of mental health. Classic example here is somebody binge drinks on a Saturday night, they wake up hungover the next morning, but they're not engaging in addictive behaviors, and the binge drinking was not related to their emotional well-being. They were doing it at a party or something. Versus people who may engage in binge drinking as an emotional coping mechanism or be addicted to alcohol. In these cases, we can distinguish between those kinds of behaviors based on how people are talking about what they're doing. Talking about going to a party versus talking about going to drinking to cope with your stress or your anxiety are two different things. You can also think about these in terms of sequence modeling as well, where if somebody talks about binge drinking 8 times in a month, that is much different than binge drinking twice in a month. And so we can use some of the metadata gleaned by knowing if somebody's been drinking in the sequences to be able to infer, well, maybe this is more problematic binge drinking behavior that should be further considered as something that may be a warning sign for us or somebody else to investigate further. Similar behaviors happen with this as well, which is how we can work with the doctors to be able to deal with these ambiguous, but in sometimes conflicting series of behaviors that not everybody, engages in binge drinking because they are dealing with depression or anxiety.
Excellent. Okay, I think we better cut it off right there. But thank you so much, and I'll turn it back to Joelle.
Thank you so much. I'm sorry we didn't have time to get to everyone's questions, but I saw that there were many very provocative and interesting questions in the Q&A. So thank you all for your attention and interaction. And I want to share a final thank you with Professor Chancellor for sharing this important work with us today. I think we just scratched the tiny bit of the surface of what she's working on. So we'll share some links to her research page and such when we send the follow-up email so you can investigate more on what she's up to if you'd like. And as a reminder, we are recording the presentation today. We'll send you a link in an email in about a week. If you found this talk interesting and you think others would enjoy it, please feel free to share that. And I did want to mention that our students are a key demographic that can fall prey to mental health consequences of social media use. And if you're interested in doing something to help, our college does have a student mental health fund that folks can support. So I've got a link up here. There's also one in the chat, and we'll include that in the follow-up email as well, if you're so inclined to look into that further. And I'd just like to quickly end by sharing the next event coming up for CSE alumni and friends. It'll be an in-person event, a day of service at the Bakken Museum here in Minneapolis on Saturday, April 20th. But if you don't live here in Minneapolis, there's a U of M day of services happening across the country and even at some international sites. So you can go to umnalumni.org/day of service to see all the sites, but we'll include the link to the CSE site again in the follow-up email. If you're looking for other events from our college, there are always many. Our departments are very active in hosting interesting events throughout the year. You can find the full details of all of our events coming up at csc.umn.edu/events. And if you have any questions for me about getting involved as an alum of the college, you can always contact me at cscalumni@umn.edu. So with that, I want to give a final thanks to Professor Chancellor for being with us today, for all of you for your time and attention. Thanks so much for being here, and I hope you have a wonderful rest of your day. Thanks so much.